Okay, well, welcome everybody. It's fantastic to have so many people from around the world here. So good morning, good afternoon. I don't think it's evening anywhere that anybody is from, but anyway, so I hope your day is progressing well thus far, and welcome to the first webinar in this double bill on the topic of antimicrobial resistance as part of the Community Engagement Within Research Uptake series. This event is being brought to you by the Global Health Network and its knowledge hubs, ARC, which stands for Applying Research to Policy and Practice for Health, MESH, the Community Engagement Network, and the Antimicrobial Resistance Hub. My name is Paul Cooke. I'm Professor of World Cinemas at the University of Leeds, and I co-lead CE for AMR, which stands for Community Engagement for AMR. I'm delighted to be joined today by Dr. Rebecca King, who co-leads CE for AMR with me at Leeds, Professor Romana Hock, who is Executive Director of ARC Foundation in Bangladesh, and Abriti Urjal, Senior Qualitative Research Officer at Herd International in Nepal, as well as the Global Health Network team. So, as I don't really need to tell, I'm sure everybody on this call, AMR is one of the most complex public health threats in the world, requiring coordinated efforts from governments, the public, and a range of stakeholders from different sectors. We used to talk about this as the new pandemic. However, we can't really talk about AMR in those terms now. However, as we know, this is still a global threat. This webinar and the second part to be held next Thursday on the 19th of May at the same time will explore the potential of community engagement as a means of supporting research-informed change in health policy and practice, with a focus on AMR. Speakers will share their thoughts and experiences of the ways in which participatory and deliberative processes can unlock community-level knowledge on this issue, in turn supporting better informed and more inclusive policy making. So today, specifically, we will discuss the challenge of finding the right language to discuss AMR with communities and policymakers within different countries and cultural contexts. Specifically, our speakers will share their experience of working in this research area in Bangladesh and Nepal. So the work that we're going to talk about today is really central to what we do at CE for AMR. Community Engagement for Antimicrobial Resistance is a network of researchers and practitioners who use community engagement, in particular participatory and creative approaches, to tackle AMR in low and middle income countries. CE for AMR brings together artists, health professionals, engineers, social and environmental scientists, and arts and humanities researchers to create a cross-disciplinary platform through which to share ideas, tackle research gaps, and develop new skill sets designed to address AMR at the community level. But rather than engaging with community engagement as sort of an add-on to research, CE for AMR views these kinds of practices as integral to meeting global recommendations on tackling AMR, as stipulated both by the World Health Organization as well as country-specific AMR action plans. So today's session will last 1 hour, I promise. The last webinar on mental health held in March was recorded and is available via the link posted in the chat. Information on future events can also be found via the link to the ARC Hub in the chat, which I presume will magically appear while I'm talking. But before we begin, I just want to run through a couple of housekeeping issues. Firstly, the webinar is being recorded. You'll have seen that. I hope that's okay. The recording will be shared in the coming days on the Global Health Network, ARC, MESH, AMR platforms, as well as on CE for AMR. So you can have a look at the materials and share them. These materials can be found using the link that's just been shared with you in the chat, I believe. Also, to interact with the panel, because your microphones have been disabled, please use the Q&A function, which you can see in the toolbar. So you can type in your question there, and we'll deal with those later on. If you have any technical issues, please use the chat function rather than the Q&A function, and the Global Health Network team will assist you. If you have any general comments, please also add them to the chat function. And as I say, we have dedicated time at the end for Q&A, so we'll try to get through as many questions as possible. So without further ado, I'd like to move on to the main feature, which begins with Dr. Rebecca King. Rebecca is Associate Professor in International Health at the Nuffield Centre for International Health and Development at the University of Leeds in the UK, and is the co-lead with me for on CE for AMR. I won't do what I normally do when I introduce Rebecca, is explain how CE for AMR developed during one of our children's swimming lessons. I'll leave that for another time when we meet face to face, and I can explain how this all started. But Rebecca is going to give a quick introduction to the Handbook of Community Engagement for Antimicrobial Resistance, which is a new research output that we have just published. So Rebecca, over to you.
Thank you very much, Paul, for the introduction. I hope everyone can hear me and see the slides. Please say if not. So good morning, good afternoon, everybody. As Paul mentioned, I'm going to provide a really brief introduction to the Handbook of Community Engagement, but specifically focusing on the section that we have on engagement with national and international stakeholders. So I want to move my slides on. Yeah, there we go. So I think we're all aware, or we wouldn't be here, that the international response to antimicrobial resistance has produced multi-sectoral initiatives and global guidance that often highlight the importance of raising public awareness on AMR. But as Paul has alluded to already, information that's derived from education or awareness campaigns are just one, albeit one critical element that enables people to act. So awareness raising often suggests this idea of a top-down and unidirectional health education, and that's not always enough to trigger and sustain behaviour change. So we see the importance of a more active approach that works in partnership with grassroots organisations and communities and other stakeholders in order to accelerate sustainable behaviour change in relation to the use of antimicrobials. And we've put up here on this slide our understanding of community engagement, which emphasises themes such as equitable partnerships and the sustainability of interventions. So the Handbook of Community Engagement is an output of a collaboration between 11 partners working across 6 projects to address AMR. And I saw in the introductions that some of our other partners are here, so welcome and thank you for joining. The handbook was developed through a series of internal workshops between the partners, as well as workshops held with key stakeholders in Bangladesh, Nepal, India, Ghana, and Vietnam. And it covers 6 key themes. Please feel free to go and look at the handbook at some point if you want to. The themes are around who is the community that we engage with, and which community engagement strategies have already been utilised to understand the context in which AMR develops in LMICs. What are the One Health drivers that we have focused on when addressing AMR? What are the best ways to make community engagement scalable and sustainable when tackling One Health challenges? And how do we define success, measure effectiveness, and learn from failures? But here in this webinar, we're focusing on our 5th chapter, which is about the most effective ways to engage with national and international stakeholders beyond the community. So I'd just like to mention, we have lots of definitions in the literature of stakeholder, but we're using the term stakeholder here to mean anyone with an interested in or association with the project. And stakeholders, of course, go beyond that community with whom we're engaging and which have been identified as perhaps the beneficiaries of a project, to include other local, national and global actors. So as my colleagues will elaborate further, in the context of addressing AMR, we really need to be thinking about stakeholders across the One Health spectrum to ensure that we have a multidisciplinary and multi-sectoral approach including those working within human, animal and environmental health. And we emphasize in our chapter, and my colleagues again will elaborate further, on the fact that although stakeholder engagement often involves the sharing of outputs, actually we see that as implying engagement towards the end of a project, and really want to emphasize the critical importance of engaging with multiple stakeholders right through the life cycle of any project or any interaction to address AMR. So through building equitable partnerships during the conceptualization, the development, the implementation of any community engagement approach. So this is a theme that my colleagues will explore in more depth as well. And I'd like to say thank you very much for your attention and for being here. And I'm going to hand over now to Professor Cooke. Thank you.